Signs of ovarian cancer that are important for every woman to know. Today we will talk about an important topic that worries many: ovarian health. Ovarian cancer is a disease in which malignant, that is, cancerous, cells begin to form in the tissues of the ovaries. These small but very important organs play a key role in a woman's reproductive system. When cancer cells begin to develop in the ovaries, they can spread rapidly and affect other parts of the body. This is a very serious disease that requires attention and a comprehensive approach to treatment. The ovaries are paired organs located on both sides of the uterus. They perform two main functions. The first is the production of eggs. Every month during ovulation, one of the ovaries releases a mature egg ready for fertilization. This process is central to female fertility. The second, equally important function of the ovaries is the production of hormones. The main hormones that the ovaries produce are estrogen and progesterone. These hormones play a key role in regulating the menstrual cycle, supporting pregnancy, and even affecting a woman's overall health, including the condition of her skin, hair, and bones. In our videos, we strive to provide information based on proven facts and scientific research. With that said, let's move on to talking about the 9 common signs of ovarian cancer. According to statistics, about 6% of women experience ovarian cancer during their lifetime. This disease is more common among older women, especially those who have never been pregnant. According to the American Cancer Society, about 22,000 new cases of ovarian cancer were diagnosed in the United States in 2021. This represents approximately 2% of all cancer cases in women in this country. These figures underline the importance of the problem and the need for careful attention to one's health. The good news is that ovarian cancer in many women can be successfully cured. However, it is important to start treatment as early as possible after the onset of symptoms. Ovarian cancer often does not show early signs, and the disease can be detected in the later stages, when treatment is difficult. Most patients with this diagnosis do not show symptoms until the disease reaches a serious stage. The average 5-year survival rate for ovarian cancer is about 35%. This indicator depends on various factors, including the stage of the disease at the time of diagnosis, the general health of the patient, and the choice of treatment method, surgery or chemotherapy. Ovarian cancer is more often diagnosed in women over the age of 63, but it can also occur at a younger age. The first and most common type is epithelial ovarian cancer. It accounts for about 90% of all cases. Epithelial cancer develops from cells covering the outer surface of the ovaries. It usually occurs in women over the age of 50. This type of cancer is often detected in the later stages, as its symptoms may be minor and nonspecific in the early stages. The second type is germinative ovarian cancer, which accounts for about 8% of cases. This type of cancer develops from cells that form eggs. Germinal cancer is most common in young women and girls. It is usually diagnosed between the ages of adolescence and 30s. Despite the fact that this type of cancer is less common, it is usually treatable, especially when detected early. The third type is stromal ovarian cancer, which accounts for about 2% of cases. Stromal cancer develops from stroma cells, which form the structure of the ovary and produce hormones. This type of cancer can occur in women of any age, but is more often diagnosed in older women. It can be detected early due to hormonal changes that cause noticeable symptoms such as abnormal bleeding. Here are 9 symptoms to look out for. 1. Frequent bloating. A constant feeling of bloating or an increase in the volume of the abdomen is one of the most common symptoms of ovarian cancer. These symptoms may be accompanied by discomfort in the lower abdomen, which can often be perceived as normal menstrual cramps. Some women also have digestive problems, such as constipation or diarrhea. Although the feeling of bloating after eating is considered normal, some women may experience it more often than others. If you notice that your stomach seems larger than usual and this condition continues for a long time, you should consult a doctor. 2. Lower back pain. Unexplained pain in the lower back may be a sign of ovarian cancer. Symptoms may worsen after monthly bleeding or bowel movements. Pain in the pelvis or abdomen often spreads to the groin area. It can be permanent or temporary, but it usually feels like a dull, not sharp pain. Symptoms may worsen with physical exertion, such as coughing, sneezing, or lifting heavy objects. 3. Constipation. Intestinal problems such as constipation can signal problems in the abdominal cavity, including the ovaries. Constipation occurs when the stool in the colon becomes hard and dry due to lack of water and fiber. This may be due to the fact that the tumor exerts pressure on the colon, or rectum. Also, the tumor can cause contraction of the intestinal muscles, which makes it difficult for feces to pass. Changes in bowel movements associated with ovarian cancer may include more rare acts of defecation, a feeling of bloating or fullness of the abdomen after eating, tension during emptying, and a decrease in the frequency of defecation compared to the usual regime. If you experience frequent constipation for no apparent reason, this may be a reason for a medical examination. 4. Fatigue. Constant fatigue, even after a good rest, can be a sign of ovarian cancer. This symptom is often underestimated, blaming stress or overload, but it can indicate serious health problems. 5. Pain or discomfort in the abdomen or pelvis. Discomfort in the lower abdomen or pelvis may be a sign of ovarian cancer. These pains can range from mild discomfort to severe pain. 6. Fast satiation when eating. If you notice that you are full after a small amount of food and this condition persists, it may be a symptom of ovarian cancer. 7. Frequent urgent need to urinate. An increased frequency of urination or a feeling of urgent need may be associated with the growth of a tumor exerting pressure on the bladder. Frequent urination is one of the symptoms associated with ovarian cancer. This symptom may be caused by the growth of a tumor that puts pressure on the bladder, creating a feeling of tension and the need to urinate. When the tumor in the ovary increases in size, it can begin to put pressure on neighboring organs, including the bladder. This pressure can irritate the sensory nerves in the bladder area, which causes a feeling of urgent need to urinate. A woman may feel that she needs to urinate more often than usual, even if her bladder is not fully filled. 8. Menstrual cycle changes. A change in the menstrual cycle is another symptom that may indicate ovarian problems, including the possibility of ovarian cancer. A woman's normal menstrual cycle is usually about 28 days with some natural variations. However, if irregular menstruation occurs, changes in cycle duration, volume, or the nature of monthly bleeding, this may be a sign of ovarian dysfunction. 9. Difficulties with food. One of these factors is the tumor itself, which can put pressure on surrounding organs, including the stomach and intestines, which can cause a feeling of heaviness in the stomach and impede normal digestion. This can lead to loss of appetite and unpleasant sensations when eating. In addition, ovarian cancer can be accompanied by other symptoms, such as nausea, vomiting, or a feeling of discomfort in the abdominal area, which can also negatively affect a woman's appetite and ability to eat. Early recognition of these symptoms and seeking medical help are extremely important. Many of these symptoms may be associated with other, less serious conditions, but if they last more than a few weeks, they should not be ignored. Regular medical examinations and careful attention to your body will help you identify the problem in a timely manner and begin the necessary treatment. 10. Diagnosis of ovarian cancer. Early diagnosis is a key factor in successful treatment, so it is important to know which procedures can help identify this disease at an early stage. Ultrasound examination of the abdominal cavity allows you to visualize the ovaries and assess their condition. This method helps to detect abnormalities such as cysts or tumors and determine their size and location. Ultrasound is a non-invasive and fairly accurate method of primary diagnosis. Computed tomography provides more detailed images of internal organs than ultrasound. CT scans can provide three-dimensional images of the ovaries and neighboring structures, which helps doctors more accurately assess the condition and spread of the tumor. In some cases, the doctor may prescribe additional examinations such as MRI, magnetic resonance imaging, PET scan, positron emission tomography, or biopsy. Treatment of ovarian cancer depends on its stage and type and includes several methods. Let's look at the main ones. Surgery is the first and main method of treating ovarian cancer. Laparotomy. Is an open surgery in which a tumor is removed through a large incision in the abdominal cavity. Both ovaries, fallopian tubes, uterus, and nearby lymph nodes are also often removed to prevent the spread of cancer. The robotic approach, is a modern method in which a surgeon controls robotic instruments. This allows operations to be performed with high accuracy and minimal interference with the patient's body. Chemotherapy. Chemotherapy is used to destroy cancer cells. Medications can be administered intravenously or taken orally. Chemotherapy can be used both before and after surgery to shrink the tumor and destroy the remaining cancer cells. It is often performed in cycles alternating with rest periods to give the body time to recover. Unfortunately, however, ovarian cancer is often diagnosed at later stages. When the disease is detected at a late stage, the survival rate is significantly reduced to about 17%. At this stage, the cancer has already spread beyond the ovaries, which complicates treatment and reduces its effectiveness. Modern medicine is constantly evolving, and new diagnostic and treatment methods help to improve the prognosis and quality of life of patients. We hope that our video was useful for you. Subscribe to our channel and share this information with your friends and family. Your well-being is our mission. Thanks for watching. Take care of yourself and stay healthy.